Well, here I am again, Jeanette Zeiderveld, physical therapist, with a video for my wonderful handyman who has some trouble with what is called golfer's elbow, or in medical terminology, medial epicondylitis, pain and inflammation in the tendons of your muscles that make a fist and that bend the elbow, the wrist, that come here and attach into this part of the humerus, the upper arm bone. That's called an epicondyle. So it's a muscle group that comes together in a tendon, a fairly broad tendon. And it can really be difficult to overcome once it gets past a certain point, or if there's damage to the tendon. In any case, this video is also complementary with video number 2, I think it is, the one for the hairdresser. That one is for tennis elbow or lateral epicondylitis. And I would recommend that whoever wants to work on this area of their body to do definitely both videos. I will do the warm-up in a different way than the tennis elbow one, the one that's called the one for the hairdresser, so that there's some variety in ideas for warming up. And in this one, I will also do some of the more general release positions shorter. And that way you can decide for yourself which ones of those that you want to do longer. And then you would just pause the video with once you realize that, oh, this is something that feels like it's going to help me, and continue for as long as it feels like it's helping. That is something that you learn with repetition of doing this type of John Barnes oriented myofascial self-care. Results definitely come from repetition also. So let's start in standing with something that in myofascial release we call jiggling, or a little bit of self-rebounding. So just go and shake one or both of your arms and focus on letting go at the wrist and forearm and shoulder, and just let it go all over you if you like. Just let those hands flop around and see if they'll take over by themselves. Oh, mine are now. They're just going, yay, we get to do this. Oh, you can tell by the speed that I couldn't really make that happen myself. It feels good. So any which way, it could just be like dangling and going like this. It doesn't, of course, have to look at all like what I'm doing, just something. You can even go like this and lean back, and however you want to do it. But try to get your body to take it over. Just ask your body, hey, how do you want to do this? Okay, now some big circles with the arms. Breathe. Go the other direction. We're giving some care to our arms. Okay, now to continue, we're going to do something that's called pronation and supination, like this. Elbows are in your torso. You turn your hands over and see if you can do that all the way from perfectly flat like this to perfectly flat like that. That's normal. Okay, now up and down with the wrists and compare, especially your one that has the symptoms. Is it moving the same way? It's a good thing to make note of. Then if there is a deficit, you can monitor yourself for progress. Okay, now this way. Okay, open and close your hand. Have your wrist in a nice neutral position. By the way, these types of symptoms often also come from working on computers in ways that are mechanically not advantageous, like typing with your hand down like this or way back. You should type with your wrist in a neutral position, which is about like so, like this, at the level where your arm is horizontal. Anyway, that's just a side note. Now, the first release that we're going to do is side bending of the neck. And I'm going to do just one direction. And let's say that this is my symptomatic side. I'm going to go with my head this direction. So this is only going to be 2 minutes, and do it longer if it feels like it's helpful to you. Also, this one is on other videos, like the all neck video, which is actually a really good one to add when you have anything going on in your arms. So sit nice and upright, bend your head, let your arm just hang. You can also have your hand behind you on your back, or you can hold it out a little bit to see if it will unwind. What that means is that it will start to move in a direction of its own choosing. That's another thing that you can learn if it doesn't mean anything to you at this moment. When you do self-care in this way, with the principles of John Barnes' myofascial release, then we are always looking for input from the body and allowing movement that comes up spontaneously. We call that unwinding. So my arm is doing that a little bit. Oh, and now my head is also. My hand and the top of my head are slowly stretching away from each other, which feels really good. If you have never done any of these videos before and this is your first time, please also first watch the number 1, or I'm not sure it's 1, in any case, the introduction. It's a 5-minute video. I've been making videos for 3 years now, I think. Okay, that was just 2 minutes. Okay. Then the next one is for the wrist, so we're going to do that one 5 minutes. So again, sit up, well, on your sit bones, nice and upright. Hands go together. Now, let your arms come down whatever way is easy for you. So if this is where it's at, then that's where it's at, and you start there. I can push my hands farther down, but that's an effort. It's a big stretch. When I do that, my body is going to be going into protection to make sure that I will not get injured because it's a big stretch. So I'm going to just be here, where I do not perceive any big stretch. And my hands are now going down. Now the same position is not causing a feeling of a big stretch, except for my right middle finger, which is tighter. And so then I focus on that, because in my body I have some restriction there. So you feel what you feel. If you are experiencing problems around your elbow, then you might feel something there. And then check about your shoulders. Make sure they're not up towards your ears. Let them come down. As you focus on letting your shoulders relax, what do you feel in the arms, in the hands? Sink into your body with your attention and feel. Say, I'm willing to feel what is going on in there. I'm willing to feel what my body can let me know through feeling. Restrictions are there often because of something that happened, some reason for them. And so when we very slowly go in like this, at some point you might get to something like that, where there is what we call tissue memory of some incident or another, or repetitious movement, or just way too static positioning, where the body has been stressed and it has started to sort of build walls around that. And then actually that doesn't help in the long run, and then we develop holding patterns of, oh, don't move there. And that acts like a splint and makes our body locally restricted. Just like if you put your elbow in a splint for 3 months, everyone understands that after the 3 months, you wouldn't be able to move your elbow all the way right away. You'd have to work on it. So now what are you getting from your body? For me, the middle finger here on the right is getting more and more intense, and I know I can trust that. I'm just in a normal position. My hands are still going down as releasing occurs, and the intensity of discomfort in my finger is increasing. Oh, and now it is actually straightening a little bit. So that's a really nice release there for my finger. And it feels good. So just pay attention to what you feel, because it's going to be different for everyone. We all have a different history of how we use our body and how our body has been injured, or surgeries that we've had, or positions we've been in a lot, work we've done a lot. And the timer is going off, so that was 5 minutes. Now the next one is the other direction with the wrist. So you're still sitting up again, and now the backs of the hands go together. And now let's feel what goes on here in this position. So again, feel your sit bones, stack your torso on top of them with your pelvis in a nice neutral position, neither forward or backward. and then the rest of your torso on top of that, and the weight of your head hopefully falling into your torso, right down into your pelvis, to your sit bones. Okay, and then relaxing the shoulders. I notice that I'm having some difficulty with that right now. For some reason, my shoulders won't really relax fully, so I'm just going to pay attention to that. I'm not going to try to push them down or anything. I'm going to just be curious. Why is that? I'm going to let up on my wrists a little bit so my shoulders can relax better. Yeah, there you go. That's it. So I was trying a little bit too hard. Okay. Yeah, that's better. Now my shoulders are relaxed. I still have a good position for releasing for my wrists and those muscles that go to the elbow. And so other people might have to back up even more. I'm realizing that whether or not you can relax your shoulders is a good measure of whether you're trying too hard to get your hands all the way together. And then go in there. Feel the fingers. Feel the inside of the fingers. The inside of the palms. How do they compare to each other? If you are someone with symptoms, there's most likely going to be some difference. So just make a note of that and have the intention that you would really like to help out with this to improve the situation. Be patient. Okay, now I feel some energy moving. I feel that mostly in my gut. Something is happening. So my body is moving a little bit. Just allow it. Must be something good. I'm still focusing on feeling my hands and wrists and forearms and elbows. And then, of course, the body can also have its agenda for something else. For me, right now, it feels like it's heading towards my spine between my shoulder blades. I don't have any of those elbow symptoms. So I think my body decided, oh, she's doing something. We're going to use that for fill in the blanks. In my case, yeah, it's the rotation of my thoracic spine. And yeah, I really feel it now. So that's fine for me in this moment. You go with what you feel. By the way, your symptoms at your elbow can be caused by something quite far away from your symptoms. Often the painful area or the area that's not functioning well is it that way because of restriction elsewhere, trying to make up for it. All right, that was it for that one. Then the next one is we're going to actually work into those very muscles. So the ones on this side. In the other video, we do this. Now we do this type of position. So get your thumb into this side of this muscle group, so more towards the bend of your elbow, and the fingers around the other side of it. So there's this big group of muscles right here. They attach here, and we're going to release whatever is going on in that muscle group. Okay, so I'm going to maybe angle this a little bit. All right, timer. There you go. All right, so find a position that's easy for you. And where you can relax your forearm. I'm gonna go like this. You could also do it sitting at a table, possibly with your arm on the table and maybe even on a pillow on a table. Or you could have a pillow on your legs and put your arm on that. Your elbow does not have to be bent a certain amount, but it's not going to work very well with your elbow straight or with your elbow bent too far. Somewhere in the middle. And so you're holding the muscles and then you start to squeeze a little bit into them. Like you've got a steak in there and you're wondering how you can feel the size of it. And you have the intent of tenderizing it. So that mechanical force that you are gently applying into it will be used by your body. There are a bunch of concepts about that, something called the piezoelectric effect from pressure applied, and a bunch of other fancy terms, but this is not a science lesson. All right, and now, so mine is starting to do something. It's starting to move a little bit. And so whatever direction it's going in, can you see my hand moving a little bit? I'm following what is happening. So this is releasing. And I'm used to this. So, yeah, my arm says thank you so much. So I'm still just holding the muscle group between my fingertips and my whole thumb and the base of the thumb. But there's this scooting and wiggling around sort of started to happen from what I'm doing. And best I can, I follow that around. So in other words, I'm keeping the same grip into the tissue and applying the same little squeeze, and I'm adding also a bit of a pull. It can be towards your elbow, it can be away from your elbow, it can be perpendicular, sideways, up or down. If you don't feel your body starting to go in a direction with it, you just pick a direction. Like you could just decide that, okay, I'm holding it, I'm feeling the muscle, and now I'm going to push down a little bit and then hold it there. All in a reasonable, easy way. And this is something that is a learning process in terms of, well, how much is enough and how much is too much. So too much would be like, and too little would be like, well, you're barely even holding it and there isn't really any challenge. So that part is definitely a learning curve, so be easy with yourself. I'm going back to holding, squeezing a bit, and somewhat of a push towards my hand and fingers, and see if my body will respond with more of that unwinding. And there we go. Now I feel it pull into my shoulder, and Yeah, my body is more interested in doing something about my shoulder and spine than it is about my forearm at the moment. In case. And so I would say once you have a direction like that you've picked, I would stick with that one direction. So my arm changed position. That is part of that unwinding stuff. So now my elbow is straight, and I told you in the beginning not to start like that. But if it happens like this as a spontaneous movement when you've already been at it for several minutes, then you just go with that, okay? So that was 5 minutes for that one. Now we're going to do 2 minutes on a point in your web space of your thumb. So that is right here. So put your thumb on one side, 1 or 2 fingers on the other side. This is also a acupuncture or acupressure point, hagu. And there are some very busy muscles in there. This could be very tender. So squeeze to the point where you go like, wow, I feel that. And this point is capable of relieving a lot of pain in a lot of places in the body. So just hold the pressure. Doesn't matter where your arm is. I'm just holding it in my lap. It can be out to the side again on your leg. You can have pillows under your arm, whatever is easy. Still sit nice and upright. Oh, yeah, now I'm feeling it now. I feel a response, like my body's going like, oh, we're doing that. And my arm's going to move now, so I'm gonna let that happen. There, that's where my body wants to do that right now. Just remember that if it seems funny to you, I'm really, really used to this. I've been doing this type of self-care for 12 years, coming up on 13. Ah, nice, nice. I do this without even realizing I'm doing it. Like I might be sitting somewhere, watching something or waiting or something, and I'll go like, oh, I'm doing that. Either hand, mostly this one. So that was just 2 minutes. If you want to go longer, if you really feel something, go longer, okay? So now we're going to do another one of those short ones called arm pull. So we're going to be on the floor for this one. It's also in some other videos. So you're going to be on your back. Oof, too much light from inside. On your back with your elbow straight out like this, 90 degrees at the shoulder, 90 degrees at the elbow, and then the other arm comes in here. Now, you can hold just at the wrist, which would be really good for the tennis elbow, golfer's elbow thing. If you have the golfer's elbow situation and you are holding on that side of your forearm primarily, then only do that if it does not increase the pain, okay? If you feel pain on any release position right away, then that's not good. When you first start with one, it should be very easy. It's only when discomfort starts after a minute or 2 or 3 that that's okay. Then that's finding places, with tissue memory. Okay. You can also hold the base of the thumb like that. You can even include the hagu point. Or you can go all the way into the palm this way. or even fingers, 2 or 3 or all 4 at once. It's all good. And so you're feeling for how this continues up your arm and around to your shoulder blade. You're looking with your head turned towards your hands. Okay, now I feel it at the shoulder blade. Get the muscles between the shoulder blade and the spine to let go. Those muscles overwork so much in our daily activities. Give them a break. Arm pull like this is one of my favorite things to get relief. If I feel neck pain, shoulder tension, upper back discomfort, yeah, it's really good maintenance for the body. All right, so that was just 2 minutes, and then when I do at least 5 minutes, probably more, and I do it on both sides. And sometimes I put one of those little balls, one of those inflatable balls, next to the shoulder blade on the side of the arm being treated. That really helps get the muscles between the shoulder blade and the spine. So I think that's it. So remember, combine with that other video, the one for the hairdresser, and do any of the other videos, because everything in your body is connected, and you never know just how injuries or whatever restrictions you have in your body connect to make symptoms in a certain place. So, till next time.